Every morning, thousands of people wake up and walk straight into a stroke without even realizing it. The signs are subtle, easy to brush off, and tragically ignored. But if you catch them early, you could save your life or someone else's. I'm Dr. Jonathan Myers, a stroke specialist with over 30 years of experience helping patients prevent and recover from stroke. Today, I'll show you the 5 critical warning signs of stroke that appear in the morning and what to do the moment they strike. Stay with me because missing even one of these signs could change your life forever. Now let's talk about the first critical morning warning sign you absolutely cannot ignore. Sudden numbness or weakness, especially on one side of the body. This is perhaps the most common and recognizable early symptom of stroke. You might wake up and notice your arm feels limp, your leg feels heavy, or one side of your face isn't moving quite right. You may even find it hard to hold a toothbrush or put on your shirt. These are all red flags. The key word here is sudden. This isn't the slow stiffness from sleeping in a strange position. This is an abrupt loss of sensation or strength out of nowhere. For many people, it's subtle at first. They may try to shake it off thinking they just slept funny. But if it doesn't go away in a few minutes, or if it worsens, you're likely looking at a stroke in progress. Why does this happen? A stroke affecting the brain's motor control regions often impacts just one hemisphere. That means the opposite side of the body will show weakness. If the left brain is affected, the right arm or leg may go numb. If the right brain is impacted, the left side may be involved. This is why being aware of one-sided symptoms is so important. And this can happen even before you get out of bed. In fact, many strokes occur during the early hours of the morning while you're sleeping. You may only notice the effects after you wake up, when you try to move and realize something's off. So, what should you do if you experience sudden numbness or weakness on one side? Don't wait. Don't assume it's just a pinched nerve or a bad sleeping posture. Call emergency services immediately. Every second you wait increases the potential for permanent brain damage. Stroke treatment is extremely time-sensitive, and early action can mean the difference between full recovery and lifelong disability. Following sudden numbness or weakness, the second stroke warning sign you need to pay close attention to in the morning is trouble speaking or understanding words. This symptom can be surprisingly subtle, but devastating. You might wake up and feel mentally foggy, unable to find the right words or slurring your speech. Maybe you try to say something simple like, "Good morning," or "Where's my coffee?" but the words come out jumbled or nonsensical. You may even think you're speaking normally, while others notice that your words don't make sense. This symptom is medically known as aphasia, and it occurs when the parts of the brain responsible for language, usually in the left hemisphere, are disrupted by a stroke. And it's not just about speaking. Some people can't understand what others are saying either. They hear the words, but they don't seem to click. Imagine someone speaking to you in a foreign language you don't know. That's how a stroke can suddenly scramble comprehension. In some cases, the problem can be mistaken for fatigue or just waking up groggy. But here's the difference. Normal grogginess fades after a few minutes. If your ability to speak, form sentences, or understand simple instructions doesn't improve within a few minutes or worsens, that's a red flag. A simple test. Try saying a common sentence like, "The sky is blue today." If you can't say it clearly, or the words feel out of reach, or you say something entirely different without meaning to call 911 immediately. Don't try to sleep it off or assume it's just stress. Time is critical, and early treatment can save brain function. It's also important for loved ones to recognize this sign. If your spouse, partner, or family member sounds confused or off when they speak in the morning, don't ignore it. Acting fast could save their life. Now let's move on to the third morning warning sign of stroke, something many people overlook until it's too late. Sudden vision problems in one or both eyes. You might wake up and notice that the room looks blurry, that you're seeing double, or that there's a dark shadow blocking part of your vision, like a curtain being pulled down over one eye. Some people report that they can't focus on objects, or that their peripheral vision has vanished completely. This kind of visual disturbance can feel terrifying and confusing. You may think it's just your eyes adjusting to the light or assume you slept in a weird position. But sudden unexplained vision loss or distortion, especially when it affects only one eye, is a major red flag for stroke. Here's why strokes affecting the occipital lobe, the visual processing center at the back of your brain, or the optic nerve pathways can directly disrupt your ability to see clearly or interpret visual information. If a clot or blockage reduces blood flow to this region, even for just a few minutes, it can lead to temporary or permanent vision loss. In some cases, you may also experience visual hallucinations, seeing flashing lights, wavy patterns, or even objects that aren't really there. This is called visual aura and can accompany or precede a stroke in certain people. What makes this symptom even more dangerous is how easily it's dismissed. People often blame aging eyes, dry eyes, or fatigue, but remember, stroke-related vision loss usually comes on suddenly and without warning, and it doesn't get better with blinking or eye drops. So if you wake up and your vision seems off in any way, don't wait it out. Time is brain. The sooner stroke is treated, the more vision and brain function you can preserve. Now that we've covered sight, let's talk about how stroke can affect your balance and movement. The fourth morning warning sign of stroke is a sudden loss of coordination, dizziness, or difficulty walking even if you were fine just the day before. Imagine standing up from bed and suddenly feeling like the floor shifted beneath your feet. You try to take a step, but your legs feel unstable, or maybe the room is spinning even though you haven't moved. You might stumble into furniture or need to hold onto walls for support. These are not just signs of being groggy, they're neurological red flags. Balance and coordination rely on several brain regions, especially the cerebellum and brainstem. When a stroke interrupts blood flow to these areas, even for a short moment, your sense of stability can vanish. What was easy yesterday, like walking to the kitchen, can become frighteningly difficult today. Many people confuse this with dehydration, vertigo, or low blood sugar, especially in the morning. But the difference is that stroke-related imbalance usually strikes without warning and may come with no other symptoms or just a subtle feeling that something's off. You may not feel pain, but your body isn't responding normally. One telltale clue is asymmetric weakness. You may drag one foot, or your body may lean to one side, or you may feel like your head is heavy and pulled down, making it hard to stay upright. Don't ignore this. If you feel sudden unsteadiness, even if it fades after a few minutes, that short episode could be a transient ischemic attack, TIA, a mini stroke, and a major warning that a full stroke may be imminent. Every second matters. Call emergency services right away, sit down safely, and don't try to walk it off. A scan can determine if you've had a stroke and guide life-saving treatment. Next, let's look at a warning sign that's often overlooked but can be just as deadly. The fifth and final morning stroke warning sign is a sudden severe headache with no known cause, and it may be the only clue you get. We're not talking about your usual tension headache or sinus pressure. This is different. Stroke-related headaches often strike like a thunderclap, fast, intense, and out of nowhere. It can feel like an explosion inside your skull, a crushing pressure, or a stabbing pain you've never experienced before. This type of headache is often caused by a hemorrhagic stroke where a blood vessel in the brain ruptures and starts bleeding. It puts dangerous pressure on your brain tissue, and that pressure is what triggers the pain. Sometimes it's accompanied by nausea, blurred vision, or confusion, but not always. What makes this sign especially dangerous is that many people try to wait it out. They think, maybe I didn't sleep well, or it's just a migraine. But time is critical. A headache caused by a stroke can escalate quickly, leading to unconsciousness, seizures, or even death if left untreated. A good rule of thumb: if the headache is sudden, severe, and feels different from any headache you've had before, call 911 immediately. Even if you're not sure, let a doctor decide. It's better to get checked and be safe than to miss the narrow window for treatment. Also, if you wake up with a headache that's getting worse rapidly or makes it hard to speak, move, or see clearly, don't lie back down. Sit upright, stay calm, and get help right away. This could save your brain and your life. Now that we've gone through the 5 most urgent morning warning signs of stroke, Let's wrap up with what you can do today to protect yourself, your brain, and your loved ones. Let's be clear, stroke doesn't wait. It doesn't send an invitation, and for millions of people, the very first sign is the moment their life changes forever. But now, you know better. You've learned the 5 morning warning signs: sudden numbness or weakness, trouble speaking or understanding words, sudden vision changes, loss of balance or coordination, and the severe headache that hits without warning. I'm Dr. Jonathan Myers. After more than 30 years treating stroke patients across the U.S., I can tell you the people who survive and even fully recover are the ones who act fast. The earlier you spot the signs, the greater your chances of preventing long-term damage or death. So here's my advice to you. Trust your instincts. If something feels wrong in the morning, don't ignore it. Don't wait for it to go away. Call 911 immediately. Seconds can save a life, maybe your own. And now I'd like to ask you a favor. If this video helped you understand stroke better, please give it a like, subscribe, and share it with your family and friends. You might help someone recognize the signs just in time. Thank you for watching, and take good care of your brain. Every morning matters.